The way you sit on the toilet is making your sciatica worse. Every single day, multiple times a day, the modern toilet forces your body into a position that increases pelvic floor tension, tightens the piriformis muscle directly over your sciatic nerve, and adds compressive pressure on the nerve roots in your lower spine for every minute you spend in that position. Tonight I am explaining exactly why this happens, exactly which seniors are most affected, and exactly what to do differently starting today. No equipment needed, no cost. One change, multiple times a day, every day. My name is Dr. Michael Kent, 20 years working with seniors managing sciatica. Drop a comment below, your age, your city, and how many months you have had sciatica. I read every single one personally. And if you are not subscribed, hit that button right now. Let us get straight into this. Why the modern toilet is wrong for your sciatic nerve. The modern toilet seats you at a height of approximately 17 to 19 inches off the ground. Your hips sit level with or slightly above your knees. Your spine sits upright or slightly reclined. And your pelvic floor, the group of muscles at the base of your pelvis, remains in a partially tense state throughout the entire time you sit in this position. Here is why that matters for your sciatic nerve. Your piriformis muscle sits directly behind your hip joint and directly over your sciatic nerve in the gluteal region. When your pelvic floor is tensed, as it is when you sit upright on a high toilet seat, your piriformis also remains in a state of partial contraction. A contracted piriformis presses on the sciatic nerve running beneath it for 5 to 10 minutes, multiple times a day, every single day. Now add the position of your lower spine. Sitting upright on a high toilet seat flattens the natural curve of your lower back. The lumbar curve that normally creates space for the nerve roots to exit the spine comfortably disappears. The nerve roots at L4, L5, and S1, the roots that form your sciatic nerve, experience additional compression every time you flatten that lumbar curve by sitting upright on a high seat. Most seniors spend 5 to 10 minutes on the toilet 2 to 3 times per day. That is 15 to 30 minutes every single day of piriformis compression and lumbar flattening, applied directly to the nerve structures that are already irritated and compressed from their sciatica every single day, without ever realizing it is happening. And there is one more thing making this worse that most seniors never consider. Stay with me because this one will surprise you. The phone problem. Most seniors bring their phone to the toilet, scrolling through news, checking messages, watching videos. And what does looking down at a phone do? It flexes the neck forward. That forward neck position creates a chain reaction down the entire spine, increasing thoracic rounding, flattening lumbar curve, and adding additional tension through the entire nerve pathway from the cervical spine all the way to the sciatic nerve. The longer you stay on the toilet, which phone use significantly extends, the longer the piriformis remains compressed, the longer the lumbar curve remains flattened, and the longer the sciatic nerve experiences pressure, it should not be experiencing during a simple daily bodily function. The phone on the toilet is one of the most overlooked contributors to daily sciatica aggravation in seniors. Not dramatic, not sudden, just quiet daily compression added to an already irritated nerve multiple times per day that accumulates into a meaningful increase in daily sciatica severity over weeks and months. The fix: 3 simple changes. You do not need to replace your toilet. You do not need to buy expensive equipment. 3 changes, starting today, that eliminate most of the sciatic nerve compression that your current toilet habit is producing. Fix 1. The footstool place. A small footstool, a step stool, or a thick book approximately 6 to 8 inches high in front of your toilet. Every time you use the toilet, place both feet on the stool so your knees rise above the level of your hips. This one position change does 3 things simultaneously for your sciatic nerve. First, it tilts your pelvis forward into a more natural position which relaxes the pelvic floor rather than holding it tensed. Second, a relaxed pelvic floor means a relaxed piriformis, which means less compression on the sciatic nerve running beneath it. Third, the forward pelvic tilt partially restores the natural lumbar curve that sitting upright on a high toilet eliminates, reducing the nerve root compression in your lower spine. The squatting position that humans used for thousands of years before the modern toilet was invented naturally produced all three of these effects. The footstool recreates the same effect on a modern toilet without requiring any flexibility, strength, or significant physical effort. A simple step stool from any hardware or home goods store works perfectly. Even a stack of thick books works in the short term. The height is important. 6 to 8 inches is enough to meaningfully change the hip-knee relationship and produce the pelvic tilt that relaxes the piriformis. Less than 4 inches produces minimal effect. Fix 2. Forward lean. Once your feet are on the stool, lean your torso forward so your elbows rest on your knees or thighs. Not a dramatic lean. Just enough to take your spine out of its upright position and bring your torso toward your thighs at approximately a 30 to 45-degree angle. This forward lean does something very specific for your sciatic nerve. It takes the remaining tension out of the piriformis by changing the angle of the hip joint, moving it into a position that the piriformis muscle cannot maintain contraction in. The piriformis that was still partially tensed in the upright position, even with the footstool, releases completely when combined with the forward lean. The combination of footstool plus forward lean produces a hip and pelvic position that most seniors with sciatica have never experienced while on the toilet. So, one where the piriformis is genuinely relaxed and the sciatic nerve running beneath it is completely free from muscular compression for the first time in their daily routine. Most people who try this combination for the first time notice that the entire experience feels physically easier, faster, less straining, more complete compared to sitting upright on a high seat. That ease is not coincidental. It is the direct result of the pelvic floor and piriformis being in their natural, relaxed state rather than the tensed state that upright, high-seat toilet sitting forces them into. Fix 3. Time limit and no phone. Set a 5-minute maximum for every toilet visit. No exceptions. This is not about rushing. It is about understanding that beyond 5 minutes, the compressive effects on the sciatic nerve begin accumulating meaningfully even in the improved footstool and forward lean position. The modern toilet's comfortable seat design, specifically engineered to be comfortable for extended sitting, is part of what makes it problematic for sciatic nerve health. It is comfortable enough to sit on for 15 or 20 minutes without feeling the need to get up. And those 15 or 20 minutes of daily nerve compression, multiplied across multiple daily visits, are adding meaningful compressive load to your sciatic nerve every single day. 5 minutes is sufficient for the purpose. A 5-minute limit keeps the daily cumulative compression minimal even if the position is not perfectly optimized. Combined with the footstool and forward lean, 5 minutes in the correct position is dramatically better for your sciatic nerve than 20 minutes in the standard upright high seat position. The phone stays outside the bathroom. This removes the single biggest driver of extended toilet time for most seniors. No phone means no scrolling. No scrolling means no extended sitting. No extended sitting means less nerve compression. The habit change is uncomfortable for the first few days. Most people do not realize how much of their phone use has migrated to bathroom time until they try to stop. By the end of the first week, most seniors adjust completely. What to expect? The change in your sciatic nerve pain from implementing all 3 fixes is not dramatic or immediate. It is cumulative. You are removing 15 to 30 minutes of daily nerve compression that has been occurring every single day without your awareness. As that daily compression is removed, over days and weeks of consistent implementation, the nerve's baseline inflammatory state gradually reduces. Most seniors notice the first difference within 1 to 2 weeks. Specifically, the overall background level of daily sciatica feeling slightly calmer, not because anything dramatic has changed in their spine or nerve, because one source of daily repeated compression has been consistently removed, and the nerve has had 2 weeks of recovery without that source aggravating it multiple times every day. 3 fixes. Footstool 6 to 8 inches high. Forward lean elbows on knees. 5-minute limit with no phone. Starting today. Multiple times every day. Every day. Drop a comment right now and tell me, did you know your toilet position was affecting your sciatica? Are you going to try the footstool? I read every single comment personally. Share this with someone whose sciatica never fully calms down despite doing everything else right. Subscribe and turn on notifications because every week this channel brings you something equally practical and equally overlooked. 1 footstool, 1 forward lean, 5 minutes maximum, starting today. This video is for educational purposes only and is not medical advice. Individual results vary. Those with hip replacements or mobility limitations should consult their healthcare provider before changing their toilet position. Always consult your qualified healthcare provider regarding your specific sciatica condition. Dr. Michael Kent is a senior health educator with 20 years of experience, not a licensed physician. Nothing here is intended to diagnose, treat, cure, or prevent any condition. Viewer discretion advised.